Hi, this is Dr. Mark Charrette. In this section, I'm going to discuss the patellar subluxation. The patellar subluxation. What is it? A patellar subluxation is the fixing of the patella out of its normal juxtaposition with the surrounding structures due to mechanical trauma, dyskinesia, or even infection. These injuries result in a decrease in the range of motion of the knee and inefficiency of the attached muscles and ligaments on flexion and extension. How does it happen? Well, it can happen by congenital or traumatic decrease in the femoral interpatellar groove, especially in the lateral hip. Also, a tearing of ligamentous attachments to the patella due to trauma can cause this. Trauma to the quadricep muscles that attach to the patella, particularly the vastus lateralis, in dystonia can also occur. Tearing of the collateral and cruciate ligaments due to trauma. And lastly, trauma causing displacement of the femur, tibia, and patella. What are some of the symptoms associated with this when the patient presents? Acute tenderness around the patella, erythema, edema, pain, locking, and even catching or giving away at the anterior knee. The diagnosis and examination. You may find the patient limping, also swelling around the patella, visual evidence of displacement, crepitus, compression tests are painful, apprehension testing may be painful, palpatory displacement, tenderness or weakness of muscles, and an excessive Q angle. Muscle imbalances may be involved. In the genu-valgum, you'll find external rotators of the femur out of balance with the internal rotators of the tibia. Also, the antipronators of the ankle are out of balance with the vastus medialis. In genu-varum, the internal rotators of the femur are out of balance with the external rotators of the tibia. Antipronators of the ankle are out of balance with the vastus medialis. Chiropractic management of this case involves daily ice sessions, 20 minutes at a time, followed by active short arc knee motion. Correction of the hyperextended gait through gait training. Third, submaximal pain-free isometrics progressing to maximal. 4, physiotherapy modalities. 5, chiropractic adjustments to normalize the femur, tibia, and patella. Custom-made functional flexible orthotics based on biomechanical need. Rehabilitative exercises. The knee and hip Thera-Ciser series. Second, short arc terminal knee extension with the toe in. And third, the ankle series. As far as prevention goes, custom fit functional flexible orthotics will control the biomechanics of the lower extremity. This is the bulge test for the patellar subluxation. The headward hand makes a U shape and cups the superior aspect of the patella, pressing slightly posterior and inferior, compressing the suprapatellar pouch. The other hand gently milks fluid medial to lateral. This footward hand is then released. A positive test would be a fluid wave going lateral to medial. Now let's review normal patellar motion in a relaxed, non-weight-bearing state. The patella, when it's non-weight-bearing, should be able to move superior, inferior, medial, and lateral like you see. When the patella does fixate, it will usually be in a superior or superior lateral direction. If the doctor presses inferior or inferior medial and there is fixation, a restricted range of motion, this is how the adjustment is performed. The doctor will take his or her thumb webs and cup the superior superior lateral aspect of the patella. Then, via bilateral triceps contraction, the doctor will thrust inferior or inferior medial as you see me do. So it's a nice crisp thrust like this.